These three regions, the scapulus, the scapula, the shoulder itself, and the cervical spine are like friends who fight and then make up, and then fight again, and make up again. It's also common after bursitis for some issue to appear in the scapula or the cervical spine. That's because these three regions, let me draw here, make a cute little drawing. Here's someone from the back. Okay, the hair. This is so you don't get confused. Okay, guys? Look, here's the shoulder. And here's the scapula. These three regions, scapula, the shoulder itself, right, which is actually a joint complex, and the cervical spine, they're like those, like the three musketeers, they always go together. Like those friends who fight and then become friends again, and then fight again and become friends again. You know? So if it started acting up and even showed bursitis, for sure, the other two were already involved in this bursitis problem. We have other videos about bursitis here on the channel. You can search for them later. Just search here on YouTube for Dr. Alexandre Mota. Bursitis is caused by mechanical Lamefa imbalance. And it's easy for us to work with it. All right? So bursitis is the result of an imbalance, either in the scapula, the cervical spine, or both, or even all three at the same time. The fact that you treated the bursitis, I imagine, with medication, with physical therapy that only focuses on the area of pain, it's very likely that you think you've solved the bursitis, but the problem remains. The underlying issue is still there. And now you're not feeling pain here anymore. But now your neck has started to complain. Now, let's do the following. If one area has already started acting up and the other one has too, it's very likely that the problem is here in the scapula. And now I'm going to suggest two easy, simple exercises for you to address or at least reduce the cause and get these three musketeers, these three friends, these three neighbors back together. All right? For the first exercise, you're going to need a wall. Let me move this flip chart out of the way. There. At first, it might be a little difficult for you, but I want you to put your hands on the wall, preferably at shoulder height. Alexander, my bursitis still bothers me when I bring my hand up here. Keep it lower. But ideally, you should bring it up to shoulder height. In this position, you will keep your elbows straight, both elbows straight. Don't bend your elbows, and you're going to do this movement here. Look, letting your body fall forward and then coming back. Do you notice that the movement is happening exactly in the shoulder blades? In the beginning, it's going to be hard for you to do this. Most people have this difficulty. But I ask you to keep trying. Later, it will get really easy, just like it's easy for me now. One thing that might help you is to check if you're not bringing your shoulder up close to your ear, because then you really can't move it. Relax, like a turtle coming out of its shell. So just relax your shoulders. And here, see, you can move a lot more. Try to go until your shoulder blades touch in the back. And come back as far as you can. See? And pay attention, the elbow doesn't move. The movement happens entirely in the shoulder blade. My body goes forward and backward. You will do this exercise until you feel that freedom of movement. Feel that there's more lubrication, you're able to move your scapulas, your shoulder blades more. All right? But I want a specific number. I want to do it a certain number of times. Do it 30 times, trying to go as far as you can and come back as far as you can. Go as far as you can, come back as far as you can. No rush, please. The other exercise you can do to work on the scapula, focused on the scapula, is an exercise that's like a go-to remedy. You know that go-to remedy everyone has? You know, sometimes it's a pill, sometimes it's an ointment, sometimes it's even a cleaning product. One of my patients used to use Veja. Actually, it wasn't Veja, it was oil, Buriti oil, which she said improved the movement of the joint. Here you go, everyone has this miracle cure. This exercise I'm going to show you now works wonders for the scapula and as a result for the problems that stem from it. Also at first, it will be a little difficult, but keep at it. Come back here, watch the video again, do it with me, and you'll be able to do this exercise. In this exercise, we'll work the subscapularis muscle. It sits underneath the scapula, between the scapula and the ribs. So the way to find this muscle is right here. Look, you raise your arm and you move your fingertips as if you were separating the scapula from the... Okay? 2 fingers here. Keep going in along the scapula, right? To help, you can put this hand here on your shoulder. See, and that puts it in just the right position. You put your hand here on the ribs, feel the scapula, try to separate it. Go slowly because this can be very painful. Look at the movement I'm making here. I move it back. There will come a point where you'll feel discomfort. You can go up, you can go down. Look for the most painful spot. In my case, up here, it's really painful. Once you find that painful spot, keep a light pressure, just a little pain, the minimum pain, and you relax the arm that's raised and keep that pressure. You'll see that this pain will decrease in the next 30 seconds. If you can hold it for a minute, you'll see that the muscle itself will get more relaxed, softer under your hand. You can find and work on up to 3 of these more sensitive points. All right? Alexandre, the pain is gone here. Look again. Try moving up a little more or down a little more. You'll find another spot. Keep the pressure. Try to relax the arm that's on top and wait for the pain to decrease and the muscle to loosen up, to get softer. I can't do it, but you can. If your fingertips are more flexible or else my nail's too long and it hurts. You could also use your thumb for this. See how it works here. Can you see it like this on the camera, Erico? Thumb, you go deeper until you find the sore spot and just relax. It's the same procedure. You'll see what works best for you. 2 or 3 sensitive spots on the subscapularis. When you finish these exercises, you'll notice that your arm will feel much lighter. You can even compare one side to the other, right? It feels looser. You use less effort to move, and that's exactly what we want. And you'll see that your neck isn't hurting anymore. If you have any questions, leave them in the comments. If you thought of someone who feels any of these pains, send this video to them. If not, if you don't know anyone, click on like here so YouTube can show this video to more people. Or you can send it yourself to the family group, work group, friends group, soccer group, or even the bingo group if you're around my age. That's it for now. Big hugs and see you next time.